te loolu nag la ñuy def fii ci Semester Avenue sargal Gambian diaspora ñu wax ñu seeni jaar-jaar tukki coono la waaye ñefe fula la kon doog yéen na bari fula.
دون سلاب مختلف الألوان فيه شفاء للناس. محمد صلى الله عليه وسلم قائل إن لا ما من داء إلا وله دواء إذا مرضتم فتداووا ولكل داء دواء إلا الداءين الموت والألم. الحمد لله balaa ñoo ñaan nuyu ñëpp sant ñëpp His Excellency Président ak mboolem nguur gi ku nekk sa façon ak sa ak woon bëgg ñu dëkkee réew mi ñëpp lii ñu woote lu am solo la buñ déglu waxkat yi nga xam ne dañuy yàq xeli nit ñi yàlla su boppam wax ci alquran ne lu ne amal na ko garab sóoratu nax li dégg nga jàng léegi mu wax garab gi lekk ci lem ne lépp lu mën a doon rek am na yonent bi na jàngoro ju ne am na lu koy saafara mu ne su ngeen feebaree na ngeen faju ji ndax feebar bu ne am na lu koy saafara ba mu des ñaar rek mooy màgget ak dee yàllaa ko sàkkal waxtu bu jotee mu kii kon danañ gërëm na WHO World Health Organization bii feebar yu bari nekkoon ci réew mi ñoo ko fi jëlee amoon nañ njàmbataan am kuréel am jàddaaral am li nga xam ne moo doon li ñuy wax ràmm ak nas ak wagam defoo yoon na ñëpp fexe péngu buñ déglu yàqkat yi nga xam dañuy wax naan péngu bi nii péngu bi ne ba bañ a féngu kon ku ko ci def itam boo loroo yàlla sa bopp boo loree keneen koo dendeel yaa ko lor yàlla musal ci loolu a'uuzu billahi mina shaytaani rajiim bismillahi rahmaani rahiim alhamdulillahi rabbil aalamiin arrahmaani arrahiim maaliki yawmi diin iyyaaka na'budu wa iyyaaka nasta'iin ihdina siraata almustaqiima siraata allaziina an'amta alayhim ghayril maghduubi alayhim wa lad-daalliin amiin ربنا تقبل منا انك السميع العليم وتب علينا يا مولانا انك التواب الرحيم ربنا هب لنا من ازواجنا وذرياتنا قرة اعين واجعلنا للمتقين اماما اللهم اجعل بلادنا غامبيا بلدا امنا مطمئنا يا تارس قد من كل مكان ونجنا من كل بلاء وقلا وتعن وسنا ووباء تعذ من جميع ذلك بلادنا خاص بلاد المسلمين عامه بحرمة اللهم صل على سيدنا محمد الفاتح لما أغلق والقاتم لما سبق الناصر الحق بالحق والهادي إلى صراطك المستقيم وعلى آله حق قدره ومقداره العظيم. إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا وسلموا تسليما سبحان ربك رب العزة عما يصفون. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين. بحرمة اللهم صل على سيدنا محمد الفاتح لما أغلق والقادم لما سبق الناصر الحق بالحق والهادي إلى صراطك المستقيم وعلى آله حق قدره ومقداره العظيم. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. بحرمة لا إله إلا الله لا إله إلا الله لا إله إلا الله محمد رسول الله صلى الله عليه وسلم. آمين. توفيق جرق مچ أكبر
I now invite Bishop Idoko to lead us in the Christian prayer. Bishop, welcome.
In God's name, Father, Son, and Holy Spirit, amen. Gracious and eternal Father, most holy God, Father of all mercies, the Creator, the Sustainer, and the Protector of all human name, this day on the launch of the national launch of COVID-19 vaccination program in this land. We thank you for the government of the day. We also thank you for all our development partners that are working hand in hand with the government. We thank you also and present before you the front-line workers, the health caregivers, the doctors, the nurses, the pharmacists, the health administration, the cooks, the orderlies, the cleaners, the drivers, and all the security and all Red Cross volunteers throughout the length and breadth of this nation. We commit them under your direction. We pray that by your almighty power, you shall grant them the grace to be, as they execute this sacred task of caring for the sick, grant them the patience, grant them the love, and grant them the dedication, and also grant them the wherewithal to execute this duty in the most effective and efficient manner. We continue to pray that you bless this program, bless the vaccination that will be used nationwide. We pray that it will be effective in eradicating from this nation this COVID-19 and its cohort, the new variants. You, the healer of all, we pray that by your almighty power and by your healing, miraculous, wonder-working power, that you shall grant the most effective, efficacious healing in this vaccine, so that all will be healed and everything will return to normalcy. Grant us in this nation and in all other nations of the world, grant all of us clean bill of health. This we ask through Jesus Christ our Lord. Amen.
Let's stop our prayers and thank you for the time. His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow, Her Excellency the Vice President, Madam Dr. Aisha Ture, the Honorable Minister of Health, Dr. Ahmed Lamin Samate, and Cabinet Ministers here present, Secretary General, Secretary of Cabinet, religious leaders, directors here present, program managers, advisors to the President, the media, and anyone who is able to find time out of their busy schedule to attend this important occasion. I say good afternoon to all of you, and today we are here to witness the launch, or the national launch of the COVID vaccination campaign, which is going to be launched by His Excellency the President, to at least to give us the courage to take this vaccine, and as well as to raise awareness among the general public. I also want to recognize the World Bank, the WHO, UNICEF, all other UN agencies that are present here. I also want to recognize our President and thank you for coming. I don't want to waste much of your time. Time is not really on our side, and I will go straight to the program. And here I now invite the representative of WHO, that's the WHO country representative, Dr. Desta Tiruni, to come and give a statement. WHO rep, you are kindly welcome to come and give your statement.
Thank you, Program Director. Your Excellency, Mr. Adama Barrow, the President of the Republic of the Gambia, Your Excellency, the Vice President of the Republic of the Gambia, Dr. Satu Ture, Honorable Dr. Ahmad Lamin Samate, Honorable Minister of Health, Honorable Members of the National Assembly, Honorable Members of the Cabinet of Ministers, Your Excellencies, Ambassadors and High Commissioners from European Union, the United Kingdom, United States of America, Germany, France, Spain, and Qatar, who are present here with us. UN Resident Coordinator, Ms. Serafin Wakana, my colleagues, resident representatives of the UN agencies, high government officials, National COVID-19 Response Coordinator, media representatives, ladies and gentlemen, all protocols duly and respectfully observed. I'm really honored and delighted to be part of this important landmark event following the arrival of the COVAX vaccines, which is a dream come true for the Gambia and for the whole world in the fight against COVID-19. As you all know, the number of COVID-19 cases is still high around the world. It's declining in some countries and increasing in the others. In Africa, we are observing a downward trend in the new cases, with 56% decline between January and February. However, this trend is driven by some of the most affected countries like South Africa, which are contributing to the huge part of the COVID-19 cases. So it's not uniform. Even in Africa, in some countries, it's increasing, in others declining. 11 countries have reported an increase in the number of cases of COVID-19. As of 6 March, the African continent has reported more than 3.9 million COVID-19 cases and 105,482 deaths. 10 countries are accounting for 75% of the cases in the African continent. In the past 28 days, South Africa leads with more than 46,000 new cases in February, followed by Ethiopia with 23,000 cases. Zambia, Nigeria, Mozambique, Ghana, Botswana, Senegal, Kenya, and Malawi account for 21% of these cases. Similarly, the Gambia has also experienced the second wave of the pandemic in Africa, with an upsurge in the number of cases and deaths. Therefore, we can understand COVID-19 is with us and will remain with us for quite some time to come. So we are not over it. The arrival of vaccines through the COVAX facility in the Gambia and Africa is a significant triumph in the history of public health and should be celebrated. COVAX facility is one of the three pillars of the access to COVID-19 tools, which is known as ACT Accelerator, established to accelerate the global development, production, and equitable access of COVID-19 tests, treatments, and vaccines. COVAX is co-led by Gavi, the Vaccine Alliance, the World Health Organization, the Coalition for Epidemic Preparedness Innovation, working in partnership with UNICEF, as well as the World Bank, civil society organizations, manufacturers, and many others. COVAX aims to achieve 4 objectives, actually 5 objectives. One is to make sure at least we have enough vaccines for 20% of all countries participating under this umbrella. The other important objective is also to be able to access diverse group of vaccines which are actively managed. So we'll be able to access several types of vaccines that are effective as they come into the market. The third one is also delivering vaccines as soon as they are available because of the guarantee, the advanced market commitment, which is granted through the COVAX arrangement, will also guarantee quick market for the producers. So this is also makes it faster to reach or to access these vaccines. Ending the acute phase of the pandemic is also the ultimate objective, to stop the pandemic. And if we stop the pandemic, we'll be able to achieve, we can rebuild economies. This is the objective of the COVAX arrangement. It's a noble objective and a noble partnership. Your Excellency, this is the first time that countries have come together to fight the global pandemic, a global threat with unprecedented solidarity. Without COVAX, many low and middle income countries such as the Gambia would have been completely left out and wouldn't have been able to witness what we are seeing today. The COVAX facility has so far delivered more than 11.6 million vaccine doses to 17 African countries, and more are yet to come. Here is what the World Health Organization Director General, Dr. Tedros Adhanom Ghebreyesus, said when he witnessed the first arrival of vaccine in Ghana. That was the first arrival. This is what he said. This is the day many of us have been dreaming of and working for more than 12 months. It's gratifying to see the fruits of that labor. But success is still to come. This is only the beginning of what COVAX is set to achieve. We have a lot to do to realize the vision to start vaccination in all countries in the first 100 days of the year. By that time, I think it was end of February, there are still 14 days to go. So within 14 days to start in all countries. This is what we want to achieve. And if we do that, we are successful and will be very delighted. Therefore, on behalf of the WHO and the COVAX partnership, I would like to express our sincere gratitude to all donors for putting their money and trust in the COVAX facility and making this dream come true. Please allow me to extend my appreciation and highest regard to the donors that are represented today here at this occasion for the generous support and donation. These are the European Union, which includes the European Commission and the Team Europe, the United Kingdom, the United States of America, Federal Republic of Germany, France, Spain, and Qatar. Thank you so much for your support. The arrival of the vaccine gives us a great hope to contain the effect of COVID-19 in three ways. One is to protect the most vulnerable group of the population from getting COVID-19 and save lives. The second is, if we do that, we will preserve the provision of essential services by reducing the number of severe cases that will be admitted and that need care and that will be exhausting the resources of the health services. This is the second. And if we can achieve this, we can stimulate also the economy, the economic activities, and speed up recovery. Your Excellencies, the fastest and most efficient way to do that is to ensure we protect our health workers and we protect our older populations and people with comorbidities, with pre-existing conditions. That's going to be the fastest way to get us out of this pandemic. However, I want to emphasize that countries cannot solely rely on vaccines. The vaccines alone are not sufficient to contain the transmission of COVID-19. As you have witnessed, many countries before the arrival of the vaccine were able to contain the spread of the disease. And we have very good examples around the world. So we have to use the time-tested basic public health measures, and this remain the foundation of containing the spread of the disease. That's to say, mask wearing, like what we do, physical distancing, the way we are sitting, keeping distance, we have to maintain this, and hand hygiene. This we have to maintain all of them at the same time. It's not one or the other. All of them, three of them are all the time, everywhere we are. That's what's going to actually help us to stop the pandemic. The WHO focus now is at keeping the transmission low, prevent the emergence of new variants. We have heard about the emergence of new variants that are not responding to vaccines. So vaccines by itself is not a solution. If we don't stop transmission, the new variants can spread and we may go back again to square one. So it's very important we contain the spread through the public health measures. Mask, distancing, hand hygiene. I repeat it, very important. It will take us out of this mess. When celebrating the COVAX victory in ensuring access to many countries around the world, we should not forget to pay due respect and heartfelt appreciation to the government of the Republic of the Gambia, particularly His Excellency, the President of the Republic of the Gambia, Dr. Mr. Adama Barrow, Her Excellency, the Vice President of the Republic, Dr. Aissatou Touré, the Vice President of the Republic, and Ministerial Subcommittee, Honorable Amadou Samate, for their leadership and commitment through these difficult days during the COVID-19 pandemic. We are also greatly indebted to health workers who have always been and still are in the forefront of the fight against COVID-19. Your dedication and commitment is highly appreciated. Thank you so much. But health workers were not alone. There were many other frontline workers who kept us through the difficult times, who supported and facilitated the work of these health workers, both in the public and private sector, like the armed forces, the police, those who are running the shops, those who are running different businesses, who were able to supply the commodities, the essential supplies that we require for existence. So we really appreciate all of you for all your efforts and solidarity in this difficult time. In WHO, we are very grateful to all partners who forged strong partnership with the government of the Republic of the Gambia in its fight against COVID-19 since February 2020, before even the case was reported here. Partners gathered together, trying to support the government to get out of this problem together. And this includes the United Nations system. In the United system, particularly, I would like to express my sincere appreciation to Ms. Serafin Wakana, who is the resident coordinator, who led the UN team so brilliantly to make sure that the support is well coordinated. And among the UN agencies, I cannot name all of them, but I can mention like UNICEF, World Food Program, UNFPA, UNDP, UNOPS, IOM, FAO, and many others who came together and worked day in, day out, and supporting the government effort to make sure that we succeed in the fight against COVID-19. The private sector, the Gambian Red Cross Society, institutions and private citizens who supported the COVID-19 response technically, financially, and in kind. All of you, thank you very much for your solidarity. With that, I think I would like to end by quoting my Director General, who said this: "We will not end the pandemic anywhere unless we end it everywhere." I thank you very much for your attention.
Thank you very much, Dr. Desta Tulidi, the WHO country representative, for sending out a clear message with regards to reminding people with regards to the messages that we have been talking about. In addition to the vaccine, I am sure when those messages have been practiced, we can be able to cut down the transmission of COVID-19 in this country. Your Excellency, I also want to recognize the presence of the CMD EFSTH. He's here with his team. I want to recognize Dr. Sam of the World Bank. The able organizing committee of this event, I want to recognize your presence. EPI and the health promotion team, well done, and thank you for the excellent coordination of this event. The UNDP, UN Resident Rep, the Secretary General of the Gambia Red Cross Society, and as also the National Coordinator for COVID, I want to recognize your presence. And on that note, I want to now invite the UNICEF country representative, Jonathan Lewis, to give a statement. Thank you, Jonathan. Welcome.
Thank you, Master of Ceremonies, Your Excellency, President of the Republic of the Gambia, Adama Barrow, Madam Vice President, Isatou Toure, good to see you at this event. Honorable Minister of Health, Dr. Amadou Samate, other members of the Cabinet of the Gambia, as well as members of the National Assembly. I'd like to very much recognize and appreciate the presence of our religious leaders, the Imam as well as the Bishop. Acknowledge the presence of all members of the diplomatic community, with a particular note, of course, on our 7 COVAX donors based in the Gambia. I would like to recognize Madam UN Resident Coordinator and all other heads of UN agencies, funds, and programs. Frontline health workers who are present here today. I'd like to acknowledge the beautiful musical renditions of the band that graced us during the morning. Also acknowledge the presence of the media. It is through you, the media, that the most important messages to combat and to fight the disinformation and the false information which is out there is so relevant. So thank you for being here. Ladies and gentlemen, to one and all, our good afternoon to you. Mr. President, thank you so much for extending the gracious hospitality of the State House for this important event. And I'd like to maybe recall the fact that on Monday we celebrated International Women's Day. And when we kick off with International Women's Day and March being International Women's Month, let us not forget that the real impact of COVID in many countries is the face of a girl child, is the face of an adolescent mother, is the face of a woman who's having difficulties to put food on her table. And we have seen that here in the Gambia. I'd like to perhaps try to put a little bit of context to the fact that let's not forget that we started in March 1 year ago with COVID-19, not only here in the Gambia, but throughout the rest of the world. And the socio-economic impacts are real and they are evident. Here in the Gambia, to this date, the information that we have from the Ministry of Health is that approximately a little bit more than 4,800 cases of COVID have already been registered. We have more than 150 deaths that have been registered as well. So this is very real, as Dr. Desta points out. This is happening as we speak. And also, let us not forget that at one point last year, approximately 700,000 children and adolescents were impacted by the protracted and the prolonged closure of schools. And only 46% and 36% of urban and rural households, respectively, at one point during that period, had only one active student learner either benefiting from different moments when schools reopened, for example, for the grades 9 and 12 examinations, or through remote learning mechanisms. Not only that, we are aware that the Gambia is a country which is highly debt distressed, and the impact on the macroeconomy has had a profound negative effect on the debt to GDP ratio, and this is important that we acknowledge. A recent rapid survey by the World Bank, which is called a high-frequency survey, which is also conducted in collaboration, Your Excellency, with your Gambia Bureau of Statistics, revealed that 50% of households during the peak of the impact reported not being able to stock up on food as usual, and that 9 out of 10 households suffered a decrease in income. There was a need to support families through different ministries, such as the Ministry of Health, the National Nutrition Agency, the Ministry of Gender, Women and Gender, Children and Social Welfare, to support through the provision of cash transfers, food transfers, an ever-increasing number of children in poor households who were being affected by increases in severe acute malnutrition. And at one point, the EPI program reported to us that because of flight cancellations, we had a temporary stockout that lasted 3 months of vaccines for the expanded program immunization, but most importantly, vaccines for oral polio. So this is to say that, as we all know, it is here and we have to deal with the impacts. But Against the face of the impacts, we also need to put out the information regarding practice. A recent U-Report survey, which was conducted by UNICEF in December 2020, amongst a total of 3,000 respondents, revealed some really very interesting issues that I think we should take into account. 78%, that is, 8 out of 10 individuals who responded, indicated that COVID-19 preventive measures in their area of residence are not being respected. 8 out of 10. That's what they see. That's what they're reporting. 44% of them believe that COVID-19 preventive measures are not being respected because they believe that COVID-19 is already over in the country. And finally, 88%, that's 9 out of 10 individuals, have facial masks, and sometimes more than one. However, only 45% use masks on a regular basis, which is sharply down from the 80% of regular users in the same survey that we had conducted 5 months before. So regular mask usage has gone down from approximately 80% to 45%. And I cannot underscore enough the messages that Dr. Tirone has shared with us vis-a-vis the fact that the vaccination against COVID is only one of several strategic tools in the national toolbox against COVID. To talk a little bit more about the syringes and the vaccines under the COVAX facility, let me say that at the end of this week, we're hoping that almost the entire continent is going to be covered by COVAX COVID vaccines. Already approximately 13 to 50 million doses have already been distributed. And note this, in the short span of 10 days, we were able, through the COVAX facility, to get a significant amount of number of vaccines to different countries, many of which are on the African continent. And by the end of the week of, by 10 March, that is today, we're hoping that an additional 17 countries will be receiving COVAX vaccines as well as syringes to be able to launch their campaigns. We are looking at the possibility of increasing the already secured 1.2 billion doses of vaccines that COVAX has been able to negotiate with the different vaccine manufacturers that obviously have gone through the most stringent regulatory and testing procedures led by the World Health Organization and national regulatory authorities. We hope to be able to increase the allocation to 2 billion doses by the end of 2021. You've all seen it in the news. In the case of the Gambia, we were fortunate that we were among the first 5 countries on the African continent, starting last Sunday on the 20th of February, to receive the initial batch of 37,500 syringes. We will soon be receiving almost 930,000 syringes, which together with a very generous contribution of 40,000 syringes by the Medical Research Council, Your Excellencies and Minister, you should be well on your way to be able, at least with the syringes and the doses that we have, to kick off the campaign. The Gambia will receive a total of 156,000 doses before the end of May. You all know that last Tuesday we received the first consignment of 36,000 doses, and the additional consignments to sum up to the 156 should be received before the month of April. So as you can tell, this excellent effort at global solidarity and multilateralism is moving extremely, extremely quickly, and we are all very happy for that. But vaccines are not free. They cost a lot of money. And during the height of putting forward the COVAX facility, if it had not been for the extremely generous contribution of numerous countries, high wealth individuals, foundations and companies, we would not have been able to reach a historically low value of these vaccines at approximately $2.5 to $3 per single dose, which is an incredibly it's an incredible feat to be able to reduce it to that amount. But the countries that provided to COVAX were also undergoing their own fiscal consolidation difficulties as well as their own challenges against COVAX. And we have already mentioned here the fact that present in the Gambia, we have 7 donors, and I wish to repeat them because of the fact that had it not been for them, and I'll mention one statistic which I think is really very relevant, that of the almost $4.4 billion that have been able to be mobilized from all donors for COVID, these 7 donors and their headquarters were able to mobilize approximately 69% of the total contributions to COVID. That means that 7 out of $10 of each $10 for this contribution came from these extremely generous contributions. So we wish to thank you, Mr. Ambassador of the European delegation to the Gambia, the 3 members of Team Europe, Germany, France, and Spain, the Embassy of the United States of America, the British High Commission, and obviously the Embassy of Qatar. And really, without you, literally, it would not have been possible. So we're hoping that as we move forward, we're going to be able to spread the world with the generosity and the protective value of these vaccines. As you all know, we're working hand by hand, WHO, the World Bank, UNICEF, but not just those 3 agencies. I think we also need to recognize as well your very own Gambia Red Cross Society that has been accompanying all of the discussions, all of the technical conferences that we've been having as well, and these are very important contributions indeed. So, Your Excellencies and Minister of Health, I really do want to acknowledge the excellent work of everybody involved in the response. It's been literally 24/7, and when we say 24/7, it really has been 24/7. We believe that with this, we're finally going to be able to reach that vision, which is that finally there is light at the end of the tunnel. So thank you very much, congratulations, and Godspeed.
Thank you for the presence of the Senegalese ambassador. We know they've also supported us, and I also want to recognize the ambassador and the support provided by the Senegalese government. And I also want to recognize Dr. Sow's effort. He has been working very closely with us since the start of this of planning this program, and COP and team, Chief of Protocol and team, Director of Press. We want to recognize all your support and efforts in organizing this event. I now move on to the 3rd item on the agenda, which is the joint statement by COVAX donors. It's going to be delivered by COVAX, the British High Commissioner to the Gambia is going to deliver the statement on behalf of the COVAX donors. Your Excellency, you are highly welcome to give your statement.
Adama Barrow, Your Excellency, Madam Vice President, Dr. Toure, Honourable Minister of Health, Honourable Members of the Cabinet, religious leaders, members of the Diplomatic and Consular Corps, members of international organisation and other international partners, and especially the health workers here today, the frontline health workers. Please allow me to observe all other protocols. I speak to you today as co-chair of the Development Partners Group in the Gambia, and on behalf of the COVAX partners represented here today. As already been mentioned, these include France, Germany, Spain, Qatar, the United Kingdom, the United States of America, and the European Union. Over the past year, all across the world, we have felt the impact of the COVID-19 pandemic, devastating the health of people and countries and our interconnected economies. International partners, including the G7, G20, the European Union, the African Union, the Africa Centres for Disease Control and Prevention, the Commonwealth, the United Nations, the World Health Organization, UNICEF and many others are delivering a strong global response. The Gavi COVAX is the world's best chance to provide global access to vaccines by forming an international approach to ending the pandemic through the pooling of resources to provide 1.3 billion COVID-19 vaccine doses for up to 92 eligible countries in 2021. Vaccines are the way out of this acute phase of the pandemic, and an effective vaccine is the best way to protect people from the coronavirus. It will save thousands of lives around the world, enable health workers to get back to work and deliver other health services that have been disrupted, and help begin the process of economic recovery from the impact of this crisis. But as we've already heard, and it does bear repeating, we must remember that vaccines alone at this stage are not sufficient. It remains crucial that we all follow Ministry of Health, WHO guidance on mask wearing, hand sanitisation and physical distancing, as we are still quite a ways from defeating the scourge of COVID-19. Together, caring for each other, how we as a global community will emerge from this challenge stronger and more resilient. We are only safe from the virus if we are all safe, no stronger, whether it is our economies, livelihoods or future prospects. This today is a historic step towards our goal to ensure global distribution of COVID-19 vaccines in what will be one of the largest vaccine procurement and supply operations in history. The delivery is part of the first wave of arrivals that will continue in the coming days and weeks. So to end, I'd just say we are not in this alone. Together, we can overcome this pandemic. Thank you.
And then currently we're implementing what we have planned. So we also have a surveillance meeting that the Honorable Minister is leading and coordinating. This surveillance meeting is a platform where we meet regularly, about 3 times in a week, to give an update in the various thematic areas. On the thematic area, for example, case management, you have risk communication and community engagement, you have psychosocial support and research, surveillance, and then build the laboratory, and as well as also point of entry. We meet, brainstorm, and we put up ideas, and we develop our action plans, and we implement those plans. And as we are implementing also, we review, and all these reviews are possible through the technical guidance and support from the Honorable Minister. I now invite the Honorable Minister of Health, Honorable Ahmed Lamin Kamara, to give a statement. Thank you.
Much, Mr. Chair. His Excellency, the President of the Republic of the Gambia, Mr. Adam Barrow, Her Excellency, the Vice President, Dr. Aissatou Toure, fellow Cabinet Ministers here present, the Secretary General and Head of the Civil Service, members of the Diplomatic and Consular Corps, the National Assembly members here present, the UN Country Coordinator, representatives of the United Nations systems, representative of the World Bank and that of the IMF, the COVID-19 coordinator, senior government officials, religious and traditional leaders, the Secretary General of the Red Cross, our very hard-working staff of the Ministry of Health and other frontline health workers, civil society organizations, men and women of the media, distinguished ladies and gentlemen, we are gathered here today to mark the continuation of our efforts to prevent and control one of the most devastating diseases of our time. It is by now clear to all that the outbreak of COVID-19 in 2019 has brought unprecedented and a new wave of global public health challenge, which has stretched the health systems to their limits and disrupted all aspects of lives and livelihoods at a global scale never witnessed in the last century. Efforts to protect the lives of the people and mitigate the negative ramifications of the disease have made all governments go an extra mile to provide resources to deal with the health situation and also to alleviate the suffering of the people. We have seen since the beginning of the outbreak that no government has all the means at her disposal to fight the pandemic alone. Instead, the whole world embarked on an unprecedented search for a quick means of curbing the spread and combating the disease. Accordingly, our ministry, even though challenged with the difficulty of dealing with the pandemic, continued the provision of essential services, both preventive and curative, in our health facilities. Through the leadership of His Excellency, the President of the Republic of the Gambia, the government provided the necessary direction and financial support in our collective efforts against COVID-19. This started with the setting up of the COVID-19 Ministerial Committee that interacted at various levels with the technical and expert committees to give the government the necessary advice that was needed to deal with COVID-19, and these strategies are still ongoing. Numerous interventions, including declarations of state of emergency, closure of the airports, land and sea borders, were declared by the government to help us prevent and contain COVID-19. At this juncture, we thank His Excellency for his leadership in steering the affairs of COVID-19 response in this country, and the Vice President for chairing the COVID-19 Ministerial Committee, and all my colleagues for the long hours that we spent to ensure that decisions were made to guide the government's response. At this juncture, I'd like to inform this gathering that the establishment of the COVAX facility by the Global Alliance for Vaccine and Immunization, Gavi, World Health Organization, the Committee for Epidemic Preparedness Initiative, and their partners, the partner countries, made it possible to access these vaccines, which we are launching today. We remain hugely grateful to the facility for their commitment to help the low and middle income countries protect the lives of millions of people in these countries. The COVAX facility will provide vaccines for 20% of our population. This allocation will be able to vaccinate all persons aged 41 years and above, including the priority groups. This sums up to over 480,000 people. The Gambia has received the first shipment of COVAX COVID-19 vaccines. This amounted to 36,000 doses, which will be able to cater for 18,000 individuals. This was expedited following the submission of the required documentation. Within a very short period, the COVAX vaccines were available for delivery to the country. This is indeed historic, and it is also a momentous occasion for every Gambian. At this juncture, we also want to thank our sister Republic of Senegal. Under the very good brotherly relations between our two heads of state, President Macky Sall and President Barrow, with a very good working relationship, Senegal has given 10,000 doses of COVID-19 to the Gambia. We thank you very much. Now that all the logistics are available, our plans to ensure that vaccination of healthcare workers, people older than 65 years old, 65 years and old and above, and those with underlying medical conditions, teachers, security forces, is expected to kick off today. I must reiterate that the government of the Gambia only accepts vaccines that are safe and effective, and these vaccines have passed the test. The Gambia government, in collaboration with its traditional and development partners, had come together in an unprecedented fashion to support the government in its drive to combat the disease in the country. The entire machinery had been mobilized by the President, as I mentioned earlier, to respond to the COVID-19 pandemic and its ramifications. Your Excellency, COVID-19 had been a very difficult time in the history of this country and the world all over. It has been difficult. It has stretched our health systems, especially those of us who had weak health systems before the onset of the COVID-19. It has stretched our whole health system to the limits, but with the support of government and the partners, and with the hard work and dedication of the healthcare workers, the frontline workers, we are where we are today, and COVID-19 did not have a stronghold in this country. We thank the Almighty Allah for making this possible. Your Excellency, at this juncture we pay tribute to all those who lost their lives to COVID-19, including our own healthcare workers. May Allah have mercy on their souls and grant them Al-Jannah. We will forever remember them all. They did not have the opportunity to be vaccinated. Probably if they were vaccinated, they would still have been here with us today. I think this is a big opportunity for some of us, for all of us who are alive today. Your Excellency, as we gather here today to launch the national COVID-19 vaccination exercise, using the first batch of consignment of COVID-19 vaccines, this will mark the beginning of the end of the pandemic globally, inshallah. It is therefore highly significant that all Gambians classified as high-risk groups be vaccinated. I want to take this opportunity to call on every Gambian and those resident in the Gambia, especially those regarded as high-risk groups, to get vaccinated to protect themselves, their families, and the entire population from this dangerous disease. We must close our ears to those few elements amongst us who are spreading false information about COVID-19 and the COVID-19 vaccines and dissuading people from being vaccinated. Because of the seriousness of the disease and its negative consequences, we did see at some point the Holy Haram in Mecca and Medina, as well as the Vatican, temporarily closed. I think this is enough evidence that COVID-19 is a serious pandemic, and all of us need to take it very, very seriously. We want to use the opportunity to inform the population that believing in false information could cost people their precious lives and may end up causing people to lose their loved ones. We shouldn't allow the disease to get an upper ground in this country now that the opportunity is there to get vaccinated. Your Excellency, the population of this country is known to be highly receptive to vaccination. Since the establishment of the EPI in 1979, the Gambia has been found to be quite successful in the various vaccination campaigns that took place in this country, and this has led to the eradication of some of the diseases, especially the childhood killer diseases, and we anticipate such acceptance and we work together to achieve that. Your Excellency, at this juncture, I know the day is far gone, but we want to inform the distinguished ladies and gentlemen here that the government of President Barrow has taken the healthcare system of this country to another level. There has been renewed commitment from the government to make sure that the healthcare sector of this country is second to none in our sub-region. There has been immense strategic leadership, immense commitment by government to the development of the healthcare sector by improving the health facilities. All the health facilities will be renovated in this country very soon, inshallah. We've had procurement of a lot of equipment, life-saving equipment. A whole lot of millions have been spent on the procurement of life-saving equipment in this country for the very first time in the history of this country that we bought those items. Ambulances have been procured and we continue to procure them. We are building capacity. We are training 200 extra nurses, state-enrolled nurses, and community health nurses to help us deal with COVID-19 and to help strengthen the healthcare system in our effort to reduce maternal mortality. And this we are able to do with the support of the UNDP. We thank them very much. And then the UNFPA is providing a lot of resources, many millions, to ensure that these people are trained. The UNFPA is also here. We thank them very much. Your Excellency, we also training 50 nurse anesthetists at the University of the Gambia in collaboration with Edward Francis Small Teaching Hospital to BSc level, and also 50 midwives to BSc level. All this is geared towards dealing with the healthcare challenges, and this the World Bank is supporting. We thank them very much. They are right here. The country has also started residency training for doctors in this country to health specialization. Edward Francis Small Teaching Hospital is carrying that out, and it has already started. And discussions are far advanced in getting specialist training for all the other healthcare workers, nurses, public health officers, so that we have targeted training to be able to cater for the needs of this country, including the pharmacists and all the other healthcare workers, laboratory scientists as well. So we are building capacity, because without the needed capacity, irrespective of what we put in place, what equipment we buy, what facilities we have, will not be able to deliver as the people of this country expect us to. And we thank you for your leadership and commitment. Thank you very much, Your Excellency. Your Excellency, I would like to close at this point, but once again, we want to thank your government for the leadership and for making this possible for the health sector to make these decisions, because these decisions certainly come from the highest level. We are unable to do much as a health sector if we do not get the direction and the commitment of the government from your own level to the level of the cabinet and to all our partners. We say thank you. Excellency, there are a lot of countries here, our partners, who have supported us. The Republic of China, People's Republic, the United States, the United Kingdom, the EU, Cuba, Senegal, UAE, India, and Qatar. We've been working very, very hard with their ambassadors. We've been having personal calls. They've been showing concern, and they do ask, where can we help you, Mr. Minister, so that we deal with COVID-19 and the after effect of COVID-19. And we want to use the opportunity to thank them all. They are all present here. And the final one, I want to use the opportunity to thank the healthcare workers of this country. Your Excellency, I must tell you, it has been very, very difficult. COVID-19, when people are afraid of death, when people are afraid of getting infected themselves, when we are all afraid of getting infected and our families also getting infected by us carrying the viruses home, all those fears were suppressed because we wanted to go out there and care for the people who are sick and in need of our services. And we said, come rain, come shine, whether we are at risk of death or contracting the disease or whatever, we'll go there to provide the services for the needed people of this country. That's what the healthcare workers did, and we thank them very much from the bottom of our hearts. All the volunteers, we say thank you very much, the Red Cross volunteers and other partners, civil society. A lot of people participated, and here we are today launching the vaccine, and we wish all of you the best. Thank you very much, Your Excellency. Thank you.
Honorable Ahmed Lamin Samata, I will still continue to recognize the presence of the Supreme Islamic Council President, Al-Haji Esa Dawa, and all other ambassadors I mentioned earlier from EU, UK, US, France, Germany, China, and others. So I want to recognize our presence. We now go to the final part of the statements. And before I call on this particular person, I want to say one or two words about the person. This is the person who personally directed for the Minister of Health to be supported financially at the tune of over $500 million to fight COVID-19 in this country. The same person also directed the establishment of a cabinet subcommittee to guide, to provide guidance for the entire response. And also, the same person also has been supporting the Minister of Health in terms of provision of equipment and all other medical services in this country. And the entire family, the First Lady is also joining him time to time to support the Minister of Health. And this person is no other person other than His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow. I now invite you to come and give your statement. Thank you. Your Excellency.
Fellow Gambians, friends and partners of the Gambia, we are here today to launch the Gambia's national vaccination campaign against the COVID-19 pandemic. A year ago, the country officially recorded the first case of COVID-19. At present, the infection rate stands close to 5,000 cases. Hence the restrictions imposed recently. Although most of those infected have recovered, unfortunately, over 150 deaths have been recorded countrywide. The pandemic has crossed all borders and boundaries of gender, age, status, and other characteristics. Like other sectors, not even the frontline defenders in health or the security have been spared. Our national scenario reflects the global situation with loss of loved ones, friends and citizens, both in the country and the diaspora. The pandemic has taken its toll on virtually everyone, emotionally, socially, economically, or otherwise. It is a relief, therefore, that suitable vaccines have been discovered, tested and approved by reliable experts. I am sure all of us wish that the vaccines were discovered earlier to save more lives. Thankfully, the Gambia has received 36,000 doses of AstraZeneca vaccine under the COVAX package. This is remarkable. We thank you, COVAX. Let me reassure you that the World Health Organization, WHO, has confirmed the safety and effectiveness of the vaccine for the prevention and control of COVID-19. On behalf of the government and the people of the Gambia, I express sincere gratitude to the Global Vaccine Alliance, UNICEF and WHO for this important development. Also, we have received 10,000 doses of the senior pharma vaccine from the government of Senegal. I thank my brother, His Excellency, President Macky Sall, for this kind gesture. Mr. Ambassador, we thank the President and the people of Senegal for the gesture and support. In another development, the World Bank has provided resources to procure up to 40% of the country's vaccine requirement. It will complement the 20% already secured through the COVAX arrangement. The first batch of this lot is available and will be rolled out today. This is a positive step towards realizing my government's urgent and passionate desire full protection of every citizen against COVID-19. In launching the COVID-19 vaccination campaign today, priority will be given to those who are highly at risk and the most vulnerable segments of the population. These are the frontline health workers, those aged 65 and above, and people with health conditions. With the arrival of more vaccines, the campaign will be expanded to include other segments of the population. Meanwhile, the government is working with other partners, such as NRC Gambia and Africa Center for Disease Control, to secure additional doses to meet the estimated national requirement. Ladies and gentlemen, I express gratitude to Red Cross and the volunteers, as well as individual Gambians who have contributed immensely in the fight against COVID. Government hails with much appreciation the efforts of the internal technical experts, committees, including our well-experienced, retired and serving senior government health personnel who have served in various capacities, both locally and internationally. We are grateful to our partners and friends for supporting us to fight the pandemic and recover from its effect in order to focus on building a stronger nation. Fellow citizens, to recover from the pandemic and revive our economy, we have to work together as a nation at community and national level. Together, we should take leadership and responsibility for building a healthy and strong nation. Knowing that the coronavirus knows no boundary, let us not relent. Despite the availability of vaccines, new variants of the virus continue to emerge around the world, which should compel us to remain vigilant. We must continue to act responsibly and ensure that we wear a mask properly in public, wash our hands regularly, avoid handshaking, and practice social distancing. Ladies and gentlemen, by taking an inoculation shot, I graciously and proudly declare the national COVID-19 vaccination campaign for the Gambia launched. I thank you for your attention.
ngaa gisee.
That is very by example. Why should do this?
La famille Apia.
Gracias. exactly like you said, you have to be very inside the Prime Minister. It's not like a question.
everybody to take the vaccine. It's safe and it's pain-free. Those of you who are afraid that it might be painful, no, it is not painful at all. Yeah. Thank you. Thank you.
The vaccine
Yes.
right now.
Yes. Well, I was surprised. I don't even feel there is anything in my skin because in less than a second, they told me we are ready. Everything is done and that I should wait for 15 minutes to see. I'm not feeling anything. I'm feeling normal. And I urge all of you and the whole population to take the opportunity when it is available to them to take the vaccines. It is a life-saving strategy.
What will be your message to women out there, especially mothers that prevent their daughters or children from taking the vaccine?
I want to call mothers, fathers, the whole population to give the opportunity to women and girls. The girls are the leaders today and tomorrow. The women have a lot of responsibility, and being sick is not going to enable them to engage constructively with whatever they have. So let them open the doors. Let them not listen to the misinformation that is being given. This vaccine is important for their health. COVID is a reality. I suffered from COVID and recovered from it, and I thank the Lord today that I am here to benefit from this, and I want all of them to benefit. That's why I also joined the President, His Excellency President Barrow, to take the vaccine to show women, to show all the women in the country that they should go out and do it. I've done it, and I am okay, and I believe that when girls and women are given the opportunity to do it, they will also live long. It will save their lives. We need to live long to be able to engage constructively in making the Gambia a better place.
Thank you.
Thank you very much. Thank you.
itam bari na lool yéen di baax na bu ngeen feebaree na ngeen faju mu ne jàngoro bu yàlla indi am na garabam ba mu des ñaar mooy dee ak màgget moo amul garab si kaw loolu nag World Health Organisation bi jàngoro yi nga xam ne jëlee nañ ko ci réew mi bari na yoo xam ne géte noonu na nit ñi ci Afrique bokkoon na ci njàmbataan xuréet jàddaaral yooyu yëpp dafa amoon ak li ñuy wax ngas ak ràmm ak li nga xam ne mooy waga yeneen i xeeti feebar yoo xam ne bari na lool waaye ñoom biñ istodee ñoo ko génnee ci réew mi ci ban yoon ci yooni péngu ñàkk yi ñu leen def ci lañ daan def ba feebar yi yëpp génn muy feebar boo xam ne bi péngu ñàkku dafa yàgg ku mel ni Seydi Hadji Malick bu demee ba ñàkku ba ña bañee moom moo ñàkku ñëpp gis ko daal di ñàkku kon loolu dafa yàgg muy loo xam ne lii pour dimbale rañ la ku dégg nag waxi ñuy wax ne péngu bi baaxut ba tax defuloo ko ëllëgee da nga koy réccu rek man daal li may wax ñëpp mooy nañ góorgóorlu jël ko te xam ne suñ jàmm rek moo ci nekk incha allah.
Honorable, we have seen you also take the vaccine. How does it feel?
Yeah, it's just like a normal vaccine. I didn't feel any pain. It's okay. Yeah.
Lafta ñu fani manika kangala isaje mo min yalan ko gon jibe kan surtout bamal min yalan ko ye dingo won not to take the vaccine, especially comme nyata ni tata school campaign na. So what advice will you give to those mothers or parents?
The advice la men il faut les wakil bal fangala ni dingol fang les wakil yata katunte fang yata le. So it's just a normal vaccine kon ka pengol menta aman dini so nyanta tale ngam fantanka. Yeah, it's a pleasure.
The vaccine is in Banjul State House. I'm able to make a vaccine. Sakulo na mwela le mo vaccine na banyadi.
Ni ko pengo ile amon kole ya. Amandi mi fan anu akuma ya fu mulbe yata. Bayri jata kende ko sabatindi. O mobe la hajol. Sako fa musul la karola. Bayntul musole marlen dimba yalma. Ni mo mi sasa tan ila ko katan to lebulu. Oto nyanta njato e kende ya. Sai na do ku sa kino nyama ngamul fana be to poto. Makko mulbe ko sako musulu. Ala kata le nyi pengo nyinta laje fana ko ala dimale fana be yata. Kantu jata kende akole sabatindi. Ni yajibe kurema yana ko jaral tala. Ni sai ko ni pengo da aussi itankan dama. Oto ngakata nga pengo nyinta. Kumi sa tinan sitanka noma na dimale fana be tankama. Muso belen kew mafle ko be na la penko nyinta akumata bakira ndi ngata sain ne la fele mediam kan am fen kenna so fo ne jata kina don aboro sabatindi la to mafle mul be ko ina penko nyinta akumata bakira ala baraka.
ha yalo nyim pengo ka fo pengol mi ya lonko e kadi molla puru alal de maroto e kana sasa so wala ni aso do kana jawya ngope ngole di jangbi coronavirus tato wokuma ta bakele bigo kadun alal de maroto nimmole nyin soto isaja se tanka coronavirus infection ola wara taniya soto ate jawyala puru ka kukel so wo akuma ta bakele bi
boro fen de sa asoro ala gambe de ma ko bim fana boro nyin fana soto sa atel la jarra kenda bunna ala mun sin fanya dande kadi ko boro badila nyame gambe de na tan ko
so biya datisal bawo boro na da saibe na mabodula so wo process wo datisal bi so wo kono abe janjan na banko be kan comme ali akala muta nyami na jata kende abunda la ngapengur dulal so do banko be kan region ni tata je loktanol do yalo nga nyin frijol so do je nyin friji sumalo nka pengol mabo nyami dami bari ni akala muta yalon ko pengolu imanke fenti mimu kukutoti na banko moleja na ali akala muta dimbalu ke pengol na ali akala muta de na noli ke pengol dindingol mi yalon ko man sanji lulu si ke pengol wo system o be janne andum na mol dalta pengol so pengu sifa lamu nyindo takeda coronavirus start so mbe molu hakil bulandi la ko inshallah ne nyim pengo ke alal de maroto te coronavirus sa jaw sotol so wala mun na fenkon yeah sila gitala ministre bundago muslim fa dalla karakaji ko mbole la ko ni vaccino site effect bi pour mo be se vaccino so mbole kazalate hanin nalbe ngi mo nyinnate wo fana muslim fa la di pour kata pour mol sa kala muta mimbe kerin ko a vaccine safe tale kodi so alal de maroto mbole ke kanten bari na molu fanambe kala television ol tole e be talla radio ol tole e be talla kachadulal tole anin hani nyin kanyala ngolu fanan dabe kulala kon hay musician ol be fanan killa puri da bulaje ka molu ka fo moli ko nyum vaccination safe tale bari ku killing important ni fanan be je media fana ngo mol ka ku jama mo yalto la ka sindila so naltol fane ya ko sembentu ya alal de maroto abe mol jamale be sonnal okay sai na minfo wala mu ko kabo sanji tan woro nun lulu kata santo nin sanjo la karolam bari nin mol fanan be je doliye anina loptando kulal wolu be sanjo sanji satanol bari anin molu mi alon fanan ko ye sasa dolu so min kamulun ko diabetes hypertension anin wo sasa dolu mi alon ko covid ka jawya wo mol lala wol fana be sanjo sanji faydo do satanol bari na hamen ko mu mindi wole mu ka jindi fo molu min be sanji tanin sey vaccine kana nyamin be eji jindi la wala nyam na boto to mbita sanji tanani kata sand na boto to mina fo sanji tanin sey kata sand hani na miro fo be jele kata fo sanji tanin woro kata sand bawa safety level level.
Honorable Minister, one last question before we go. That is with regards to a lot of conspiracy are going on, and then a lot of school-going children are at home now. They are not going to school. So, what advice will you give to the parents out there watching? Because at times, even their parents started warning the teachers not to give this vaccine to their children.
Okay, so I think they are confusing the vaccines because already before COVID vaccines, there is the HPV vaccine, human papilloma virus. Now that virus predisposes women to development of cervical cancer. Cervical cancer is the leading cause of death in women in this country, right? Now, by taking the HPV vaccine, inshallah, those girls, as they are now, will be protected from developing cervical cancer in the future. I think it's a unique opportunity. Cervical cancer is believed to be one of the preventable cancers, and the prevention is by vaccination. So I think it is a unique opportunity. Now, that by itself is a very good vaccine. So that's totally different from the COVID vaccine that we are launching today. So the cervical cancer vaccination, most of those girls had taken the first shot. They are about to take the second shot. So I think even with that, we are encouraging the parents to give the vaccination, to allow their children to be vaccinated. The bottom line is, if they are not vaccinated, the children are at risk of developing cervical cancer. But the danger is tomorrow, we pray against it. But if in many years' time, these children happen to develop cervical cancer, they will blame their parents for having denied them the opportunity to have been vaccinated now. So we appeal to all the parents to tell them that cervical cancer vaccination is very important. It is not COVID vaccination. However, we go further to tell them also COVID vaccine is safe with the help of the Almighty Allah. Inshallah, when we take it, we'll be protected, and it is a very important step in the prevention against COVID-19. Yes. Thank you very much. Thank you. And his entire team, the Deputy Director of Health Services and his team too, the EPI manager, their entire team, our distinguished health workers who are also here, being in the thick of things, our partners, the entire team from WHO and UNICEF, who have been working behind the scenes to make this day possible with the help of the Almighty Allah, the distinguished ladies and gentlemen of the media. I must say we are very delighted today to sit here in front of all of you to interact with you, to share our joy, to extend the message. This is an extension of the messages that were given during the launching of the COVID-19 vaccination rollout by His Excellency the President of the Republic of the Gambia, Mr. Adama Barrow. A while ago, you all witnessed that special occasion, that launching at the State House, which was preceded by the launching statements and also followed by the actual launching, the administration of COVID-19 to His Excellency the President, followed by the Vice President, followed by my humble self, and followed by other dignitaries and other opinion leaders, religious leaders, and our partners. At this juncture, it is very important to say our priority is starting with the health workers, and we are happy to say that the health workers had even started this vaccination, and it continues so that the health workers who are at the forefront of this response are given the protection that they needed. In addition to the health workers, all the frontline people, because we know that COVID-19 cuts across board, it's beyond the health sector alone. So we have our committed team of security forces who have been there with us from the beginning, and they are still with us, maintaining law and order, be it at the airport, be it at the treatment centers, be it at the sample collection sites, and wherever. So they have also been playing a very important role. We've had volunteers along the way who have also been participating in all the activities of our collective efforts against COVID-19. We have all come a long way together. The media certainly not left behind, because whatever step we take, the media had been there to disseminate the information, to ask the relevant questions, and I believe get the correct answers, the relevant answers, which were disseminated to the population. So in so doing, most of what the people know about COVID-19, and most of what they are going to know about the vaccination is going to be through yourselves. That is why your role in the success of this vaccination campaign is very, very, very crucial. So we appeal to all of you to send the message, to encourage people to get the facts so that we can report the facts. And we also, encourage the people for the uptake of these vaccines to be high, because the vaccines are protective. With these vaccines, inshallah, the people getting severe sickness from COVID-19 will go down drastically, and probably even the transmissibility and will all go down. And then the herd immunity will be established when we vaccinate adequate number of people, and that means the virus will not have a stranglehold in this community. Even when we get sporadic cases coming in, it is not likely to take a stranglehold or to take hold, because the population has developed what we call herd immunity. This is the essence of us getting together. So it is it was a very momentous occasion, and we cap it up by interacting with you. Now the rollout, the vaccine has been launched, and as you realize that people have been vaccinated, so that means the process has begun, and people are going to continue to be vaccinated across the length and breadth of this country. The EPI team has been working very hard. They have had the experience with various vaccination campaigns before, so COVID-19 is not unique in that. They have the experience, they have the know-how, and they also have the capacity. They have cold storage rooms. We have a new one in Kotu. They equally have a cold storage van that transports the vaccines to wherever they are supposed to get to. And at the sites, they have refrigerators that are there to keep the vaccines cold. So the cold chain is maintained. And at this juncture, we want to thank the partners. UNICEF has been at the forefront of vaccination in this country, and the support from the WHO. We didn't know we were going to get COVID-19, but we had that cold storage room, brand new in Kotu, which has increased our capacity. Now, thereafter, you go to the sites, you meet fridges there. We got a new type of fridge, that computerized. So those are there at the health facilities, whereby the temperature monitoring of those fridges can even be sent to a remote site, where somebody will know that the fridge in a health facility A or B is faulty. So this is how robust our system is. But in addition to that, the older fridges were still kept there. Nobody knew we were going to need more capacity. So I'm happy that those fridges were kept there, because the original plan, I learned, was not to keep them. It was to dispose them in a safe way. But fortunately, they are still functional, and that helps to maintain capacity. We thank you very much, Permanent Secretary. By way of introduction, we hand over back to you. Thank you.
Thank you very much, Honorable Minister. And now we will invite our partner, also, and Dr. also come back. Mr. Jonathan Lewis and all senior officials of the ministry, colleagues. I'm very much delighted to be part of today's event of the launch of the COVID-19 vaccination. 1 year back on this date, we didn't even have a COVID case in the Gambia. The first case was reported on the 17th, I think, if I correctly remember. So it was, but we knew about the outbreak in China and some other few places, but it was very, very small scale. But here we come after 1 year in a very unprecedented fashion the world was for the first time able to produce an effective vaccine in less than 1 year. This is really historic. And it's not only the production and availability of the vaccine, but even making it available at country level in less than a year. It's historic. And this was possible because of the COVAX arrangement that was launched. The COVAX facility, which is a partnership, as we have already said repeatedly, co-led by Gavi, WHO, and CEPI, and UNICEF. This is the partnership, and there are many people also behind it. Philanthropists, individual, individuals who contributed, and governments who contributed a lot of resources to make this mechanism effective. And fortunately, we witnessed today, because it was working, we received the vaccines, and we were able to even inject the vaccine into the eligible population. So this is really historic for public health. I'm very much delighted to be part of this and to witness this success in the public health. What is remaining now from here is now for the public to take up the vaccines and make sure that these vaccines are also put to good use. Not everybody will get the vaccine because we don't have enough of them. If we had enough vaccines, all those at risk will have been receiving the vaccine. Unfortunately, we don't have enough. So the first priority group will be health workers, as you know, because health workers serve sick people, and sick people are likely to be infected with COVID-19. So they are likely to be exposed to COVID-19. Not only that, when they are also taking care of people with other conditions other than COVID-19, they will come in contact with people with different other conditions. And they may infect as a result because of that contact. That's why health workers are very important. They are the first priority. And at the same time, we can preserve also the essential services that are needed to save the lives of many people, only if the health workers are functional and healthy. That's why the health workers are prioritized. I just want you to understand why health workers. It's not favoring them, it's just there is a reason behind it. The other group is 65 years and above age group, is because from the observation that was made since the advent of the outbreak, we have noticed that this age group is likely to develop severe illness and succumb to death, most of them. And the other one is comorbidities, what we call comorbidities, other conditions like hypertension, diabetes, cancer, and other conditions. The list is long. Those people are also at higher risk of developing severe illness and also the consequences that follow. That's why these groups were prioritized by the government. And this is in line with the guidance from WHO also. Many countries are following this, and I'm very delighted to see also the Gambia is following suit and it's doing the right thing. And what is expected now is for people to know also that this vaccine has undergone through rigorous process to make sure that it's safe and effective in protecting the people that are vaccinated. And this has been approved by the regulatory body at country level in different countries, but especially WHO has also a pre-qualification process where this is evaluated. And the WHO expert team has reviewed and listed this vaccine for use in emergency situation, which we call emergency use listing. So this vaccine has been listed and is safe and used, it can be used safely in the target population. But as any other vaccine that we know before, it might have some side effects, minor side effects, like irritation at the site of injection, fever, some dizziness, and so on. So those are common side effects that we see also with other vaccines. If there is also another side effect, we have to still learn. So that's why everybody who is developing any side effect, any unexpected effect following immunization will be monitored. And if it is a serious one, they will be taken care of. And if it is minor one, it can be treated, managed. So the message that I want to pass is that this vaccine is safe and effective. Those of you, because of the risk group that you are in, if you are offered, please don't hesitate to take the vaccine. It's an opportunity of lifetime. There are very few people that are fortunate to get that chance to be requested to take vaccine. Many are struggling. Even in rich countries where they have resources, not everybody is able to get the vaccine. It's not only money. The vaccine is not available. So we are very fortunate as a result of COVAX arrangement that countries like Gambia and many others in Africa who were not able to buy are able to access the vaccine. So we are very fortunate and we are very thankful to partners who supported the COVAX partnership and make it reality. The other thing that I want to emphasize is that the vaccines are only one of the several tools that we have to stop the transmission of COVID in the country. So the usual messages of prevention still remain very important control measures to stop the transmission of COVID-19. These are mask wearing, like what we are doing now, distancing, which we are actually having difficulty usually to keep, and that's what we see also here, and hand hygiene. And the other one I don't want to say here because it's not a good example. We are not supposed to be so congested in a small environment like this. It's a very recipe for disaster. We are supposed to have a ventilated environment when we are actually having many people together. The site where the launch was made is very spacious and well ventilated, so that was a conducive environment that we are proposing for that. So keep safe, watch out. Even if you don't get the vaccine, these measures are effective to protect you from COVID-19. So thank you very much for this opportunity, and if you have any questions later on, I will respond. Thank you. Thank you, Honorable Minister. Thank you. Yes. Thank you.
I concluded my statement at the State House this morning with the fact that we're finally seeing light at the end of the tunnel. And I just want to emphasize that because this is what light at the end of the tunnel actually looks like. The fact that you saw today and you witnessed the head of state, President Adama Barrow, the Honorable Vice President, the Minister of Health himself, as well as other members of Cabinet, National Assembly, frontline health workers, be vaccinated today. This is really what light at the end of the tunnel looks like. We've been using that metaphor over and over again, and many times people have difficulties really understanding what is it that we were referring to. We were referring to specifically this moment when we're able to actually roll up sleeves and vaccinate people against COVID-19. So it's one of many significant chapters in the history of public health of the Gambia that we're here today celebrating this particular moment. So that's one of the that's the first message I want to put out there, and I think that it would not have been possible had it not been for the, and as I mentioned before, the literal 24/7 approach that the Ministry of Health brought to this. There are a tremendous amount of beautiful stories of that commitment. There are a lot of people in this room who have been distant from many of their loved ones during many days, weekends, nights. The same thing goes for colleagues of WHO, of UNICEF and other partners, because it's a commitment to solidarity and to the cause of humanity. So for that, thank you very much. I also want to give a few examples to show how committed the government of the Gambia was to ensure that we're here today. I got a call from my regional director on the Day of Independence, on the 18th of February. And she called the Gambia country office representative as well as 4 other UNICEF representatives in the region. And the question was, are you ready to receive your vaccines? Because our mechanism that we use to arrange for the packaging, the logistics, the supply, the delivery, actually getting the vaccines onto the cargo hold of airplanes, we're ready to go with millions and millions of doses. So the question at that point is the Gambia ready to receive its first shipment of 36,000 vaccines? And I said, well, we're going to have to look into this because this is moving perhaps a little faster than we expected. So what did we need to be able to demonstrate for all of that mechanical operation to take place? And this is where I really want to thank the MOH authorities as well as other authorities in the country. Number one, ensure that the documentation of liability and indemnity is signed between the manufacturer of the vaccine, which in this case is under license to the Serum Institute of India. That was signed with the government. Number two, obtaining the necessary certification or authorization by the National Regulatory Authority. That was obtained. And thirdly, the importation license. And if you count the days between the 18th of February when we started this in motion to the very first moment of the vaccines, we're talking less than 2 weeks. So in less than 2 weeks, we were able to altogether work together in partnership. But always with that view in mind, we cannot miss out on this opportunity. Because if we said no, or if we miss out on the opportunity, the vaccines would have been given to other countries. And this is the way that it is. It's moving so fast that you really have to be on top of your game. So between the 18th of February to the 28th of February, first milestone, the receipt of 37,500 syringes. And 2 days later, the receipt of the first batch of 36,000 vaccines. So that gives you a sense of how we're doing vis-a-vis the supply mechanism, which is under UNICEF's domain. What are we expecting over the next couple of weeks? The formal allocation has already been informed to the minister up until the end of May, which is 156,000 doses, which we're hoping to be informed very soon of their arrival before the end of May. So the same process is going to happen. We will be at the airport. We will receive. We'll hand over to the National EPI program. They take receipt. They take stock. They put it in the cold chain. It's a well-oiled machinery. It's been done before. It's being done now. So we're doing very well in that regard. And in addition, the Honorable Minister will be receiving from the COVAX facility before the end of May the formal notification of the allotment up until the end of December 2021. Because the COVAX facility is intended to cover 20% of each country's needs, which in this particular case will be approximately, Dessa, you can correct me if I'm wrong, approximately 480,000 individuals. So by the end of May, we should have all 136,000 doses in the country. The minister will be informed as to the additional allocations that will be received before the end of the year. Just to say a little bit over and beyond the work that we're doing with the supply and the logistics, obviously WHO, UNICEF are working extremely hard in the planning process, including the micro-planning process. But in addition to that, we're also responsible for different areas of support, the training of the vaccinators, the communication campaigns, and that's where it's so important to count with you, the media, to help us channel the information to the farthest corner of the Gambia regarding what's happening, the importance of vaccination, and the safety of the vaccines, as well as the importance of continuing all of the other measures. So this is very important. We're also supporting with the national cold chain assessment. The minister has already alluded to the ongoing process of modernization. So with that, really, I think that we're standing before a historical date, the 10th of March, which will be known the day when the Gambia began vaccinating against COVID-19. So thank you very much, and I'll be happy to answer any questions that may arise. Thank you, Minister.
Thank you very much. Thank you very much, Jonathan. I think indeed the Gambia has registered the COVID vaccine, in Gambia, and believe it's only through and strong dedicated partnership that can really ensure that we are very much grateful on behalf of the minister.
Thank you.
So, ladies and gentlemen, we have now come to the section of question and answer, and we will leave it to the media experts to present themselves. I think by our standard, you have a cap, a limited number of questions that you register, but we just want to appeal that you register a question with candor. Yes, that is important.
Do we take a sort of couple of questions for the minister,
exactly,
so that we can arrange an answer? If there are questions for the minister.
We got 36,000 doses recently. That's what we received from the COVAX facility, and 10,000 doses from Senegal. Now, you've had the UNICEF country rep mention that we are expecting to get 156,000 for this first and second quarter. So we've had this part, and the others will come in the first quarter is almost ended. So the second quarter, we don't know the exact date, but we communicate together. So we're getting more and more vaccines to roll out. Now we got 10,000 from Senegal, and they are all going to be part and parcel of the process. Now, and then you've also heard him say that the distribution will extend towards the end of the year, all along the way. And around May, we will get a pattern of how and when what we should expect and when. So we'll get those ideas later. But we also want to remind you that the COVAX facility is meant to cater for 20% of the population. So the remaining 40%, why 40%? Because it is believed that we need to vaccinate up to a minimum of 60% of the population for us to have what we call herd immunity in the country. So that means the remaining 40% has to be catered for somehow. Now, those have all been worked out. We have had commitment from the World Bank to procure the remaining 40% for us. So that's not a problem now. And we have also engaged with the African Union, UNECA platform in Addis Ababa. They have come together, the African Union, through the coordination of African Union, to do full procurement of these vaccines equally, similar to the COVAX facility. But this one we pay for it. But so that countries are able to commit manufacturers to produce as many vaccines as possible for us. And we have already presented our country requirements to the African Union, and hopefully those ones will come alongside the ones that COVAX is going to bring. So we get these vaccines.
I just need how many people with 20% cover?
About 480,000.
Yes. So that will be about 960,000 doses, right? Good. Yeah. The next question was, yes, so the certificate. Actually, that's not the certificate for this. So the certificate, I think a lot of things are happening alongside, so we tend to think they all mean the same. The certificate you heard of is not for COVID-19 vaccination. That is for COVID-19 testing. For travelers who are going to travel and they need to be tested for COVID-19, those are the ones who will pay for the test. And the $3,000 is equivalent to about $60 US. Other countries are charging more, you all know, 150 in some countries, a little less. For the Gambia, it had been free from the beginning till now. But we think that, we need those resources to strengthen the testing. And also, we also need that so that the abuse is also reduced. because unfortunately the system was also being abused a little bit. People will go test today, another few days go and test, and then it was not being streamlined. And that was putting the testing ability of the country, it was challenging us. So we thought some fees should be paid just as other countries do. Your second question is, how do we know? Because we equally want people to come and test. Those who have what? Who have symptoms, right? How do we know the person doesn't come and say he has this or that symptom and he gets tested and then he doesn't pay? Because those ones will not pay. Okay, even if you didn't mean that, but that's also important for me to say. Let me just say that. The people who have symptoms, we want people to come out and test. But those ones will not pay. So how will we know these people are not requesting for the certificate for travel, meanwhile they presented as being sick? The people who presented as being sick will not be given certificates. Only the people who need to travel will be given certificates. So that's how we will know.
What mechanisms are you taking to find out whether these people are traveling or they are not traveling? What mechanisms are you taking to find out about it?
They are the ones who will say they are traveling.
But sometimes you might not know unless you get
So during the screening, but you see, the point is, okay, I got what you are saying. Somebody comes to you and say to you, it's not traveling, right? If he's traveling, it's his interest to get a certificate, because if he gets to the airport, he will not go if he doesn't have a certificate, right? So it is only those who are traveling look for certificate, and they are the ones to pay. The one who is not traveling doesn't need a certificate, so he will not pay. You understand? So that is it. He doesn't need a certificate, so he will not pay. Now, if a person who is traveling goes to the hospital and pretends that he has headache, he has sore throat, he presents symptoms of COVID-19 so that he gets tested. He will be tested, but he will not be given a certificate. So he cannot travel. So he will rather go and pay and travel. I hope you get the link. So this point, when we were discussing this, we also asked this internally. And this is the mechanism, right? Yes. Yes. Oh, okay. So which part of the country are we going to focus on? It's going to be the entire country. We have started, our people are on standby. It is going to be decentralized. We already have structures, regional structures. We have regional stores, the cold storage facilities are there. We have the regional public health officers. We have the regional principal public health officer of his team, the regional principal nursing officer. We have the regional directors. We have the EPI officers. So we already have the system in place. You know, they've been doing this kind of work for many decades. So those structures are there. And the vaccine, distribution process is started. Yeah. So they will get the vaccines, right? So it's going to be decentralized, because we can't also have people, elderly here and there. Health workers are also there, and they also need to be vaccinated. The plan for those who are refusing, like you said, Senegal, I think is to encourage them, not to refuse, to talk to them, to engage them, to tell them the benefit of the vaccination, because the vaccines are beneficial. And, I think today, what you show today is a very good step in trying to allay the fears of people who are concerned. There are people who are on the edge. They don't know what to believe, what not to believe. So it is our responsibility and that of yourselves to also encourage people to really understand the need for COVID-19 vaccination and the benefits derived from that, right? Yeah. So what Senegal gave us was 10,000 from the 200,000, but I guess people are still being vaccinated in Senegal as well. Yeah.
So what I meant is the plan, because Senegal right now, they receive 200,000.
Yes.
But then it's like they are giving it to other countries because their citizens, most of them are...
No, that's not the reason.
Yeah, but the president, their president said that
yes.
if these citizens are taking the vaccine, it's going to be difficult.
Yes.
That's why I'm saying, do you have any plans like that if our citizens are taking the vaccine?
No, we don't have plans like that. because inshallah our citizens will take the vaccines. So we don't have plans like that. So our citizens will continue to be engaged. You saw what happened today. Quite a number of people came, and so they'll continue to take it. But I didn't hear that statement from Senegalese government. But I don't think we got that 10,000 because their people are not taking, so they are given. It's like solidarity. They got 200,000 and they wanted to give us, support us, like brothers and sisters. If you get something, you want to give your brother something. It's a good gesture. In life you do that. Just like when you buy something, you give your friend, small, isn't it? Or your brother. So that you are saying the fight is our own. Let's do it together. Because we all know how intricate our relationship is with Senegal. If the COVID is eradicated in one country and it is still in the other is not safe. How many people will crisscross across the border every day? So it is good for us to do it together, just like we have been doing it for malaria and other diseases. We've been collaborating like this for now, well, for a while, right? Thank you. You wanted to say something?
On that particular subject, or would you like the Minister to finish all five and then we can come in?
So the second one, yes, the benefit of the vaccine, he didn't direct it to me, he just said, but I will just say a little, and the WHO expert is here. So the vaccines are beneficial. They are supposed to be protective, against COVID-19, but especially against the development of severe disease, which is the thing, that severe disease is what kills. Yeah, so I think they are protective as well. So that is why we've gone in for them. So we think these vaccines are beneficial otherwise, and they have gone through the clinical trials, and then they have been approved by the WHO for that purpose. So that the vaccines are beneficial. Maybe WL has something to add to that.
No, I think you have said it very well,
Yes.
Honorable Minister.
Yes.
I think the whole intention of vaccination is actually to protect people from getting the disease. One.
Yes.
If they get it also, it will be, I think this vaccine has an efficacy of about 63%. With the second dose, it might be higher.
Yes.
It will go higher. So which means out of 100 people that are vaccinated, about 63 will be protected.
Yes.
And they will not be able to get, they will not get infected. They can be infected, but they will not be sick. Particularly severe disease will be avoided, which is the killer. That's what we are trying. If we do that, we have achieved significant, impact on the transmission and the reduction of the mortality. That's what we want. So definitely, that's why we are doing all this. Thank you.
Yeah. But of course, the potential for those who are vaccinated being likely source of infection to other people is still being looked at. In science, it has to be evidence-based. Of course, as the WR has told you, these processes usually take longer, but because of the exigency, the need for development of this vaccine. So all those things are being looked at, and we are getting more and more data every day, so to say. But the important thing is to know that the vaccine is efficacious and it is safe. When we have that combination, efficacy and safety. Safety is very important for every vaccine. So we are very concerned about these two. And we can say that we've gotten evidence that they are both efficacious and safe.
Just a compliment on the...
Okay. No, wait. Allow him.
I think we're still answering questions.
Jonathan, can you go ahead?
Yes, please. On the issue of vaccine hesitancy, which I think is it's tremendously important, and I would just want to underscore a couple of things about this issue. Vaccine hesitancy is not unique to the COVID-19 vaccine. Vaccine hesitancy, in other words, the doubts, the questions that you see in social media, if we give it to a woman, will she be rendered infertile? If I give it to a man, will he become impotent, and so on and so forth. We have a whole bunch of myths regarding vaccines, and it's not exclusive to COVID-19. We've seen it all over the place. Whenever new vaccine regimes are introduced, people start asking questions, and it's perfectly natural for people to ask those questions. I happen to believe that the minister is, he's quite right that we will not be in a situation that we will have to return the vaccines or share them with neighboring countries. If you take a look at the latest World Bank high frequency survey, between 65 to 70% of Gambians want the vaccine. 65 to 70% of Gambians, for this particular survey, want the vaccine. So as a matter of fact, I think that we might actually need to prepare for a situation of more demand that we're actually going to be able to deal with, but we'll get to that eventually. So what do we need to do? We need to, instead of amplifying the misinformation, especially through social media, we need to amplify the truth. We need to amplify what's real. We need to amplify information that generates confidence and security in people. And how do you do that? And that's part of the campaign as well. You need a well-branded, well-designed information, education, communications campaign, which we're currently working on, which needs to use influencers. And today was an example of using influencers. The head of state, the minister, the imam, and so on and so forth. These are people who, when the population sees they're getting vaccinated, they are also going to want to be vaccinated. So you in the media, help us to amplify the truth. Help us to challenge the misinformation which is out there, because it's no small thing that misinformation can actually kill. If a person decides because of misinformation not to get vaccinated, and unfortunately he or she may become very ill and eventually die, and we pray not, that's a clear example of how misinformation kills. So please help us with that.
Very good. The last, you got a chance? I'm not going to give you a chance. Can you come with that?
Good evening. I'm Honorable reporter at Daily Newspaper. My question is, now the race have started, and then each special age group was targeted during this vaccine, and then you say 65 years above, and those with health, underlying health conditions, and then the health workers. So what other advice do you have to those below the age mentioned, and they are without any underlying health condition? Do they need to wait and allow those with underlying health conditions to go ahead with the vaccine, or they should also take part, as the vaccines are not enough at this point in time?
Yeah, thank you very much. So that's the advice, as you said. So in vaccination, everybody is important when they fulfill the criteria. But of course, we prioritize based on availability for the time being. The priority grouping could change within a short period. It could change in a day. Yesterday it could have been this, today is this, because the circumstances have changed. And also the acceptability. We want more and more people to accept the vaccine. So that is why we are encouraging people to come out. Nonetheless, for now, priority number one is the health workers, the people who have comorbidities, and also the people who are above 65, and then as time goes on, the teachers, the security forces, very important, the teachers, the hotel workers. These are all people who interact with a lot of people. If someone who interacts with so many people gets infected, he could spread the infection to many of those people, who in turn could infect many other people and then take it to their homes. This is how the disease spreads when you have, for example, in one classroom, people get infected. Hotel workers, one person working in a hotel serves so many people in one day, one shift, for example. So that exposes a lot more people. That's why it is strategic. So that is it. So we want this to be followed, so that the people who are prioritized can get it first. However, we want to do it pretty smoothly, but we also want to expedite the processes. You know, because the idea is if something is protective, it has benefits. We don't want people that it could potentially benefit, not to benefit from it, develop the disease and succumb to the disease. So that's why we want to roll it out pretty fast. Of course, the resources are, we have to balance. It's a balancing act. But we also don't want, for example, somebody who has a comorbidity, he doesn't get it on time, he develops COVID and something happens to him. So as time goes by, we get more and more vaccines, the age limit will come down to up to 18 years old, from 18 years upwards. We want to vaccinate all those people. So this is the idea. So we balance it as and when we get more vaccines, we'll come down the ladder to vaccinate more people. So this is the concept.
Madam Colleague?
Yes, my question goes to the minister. Like you mentioned, you said there are targeted people for this vaccine, and those are people that are interacting with people on a daily basis. Are journalists not part of the vaccination, because we are already with you guys here, and when it comes to the senatorians, we visited the senatorians with you guys, the treatment center. So why are you not part of the vaccination?
Yeah. So thank you very much, and I must say I must appreciate the fact that you've been there throughout. You've been there throughout with us in this room, in many rooms. We've had that. We've known that even some of your people got infected. They could have been infected at work, but they could also have been infected at home and in the communities. But that notwithstanding, you've been there. You've been at the treatment centers. You also interact with a lot of people. In fact, you go look for people to interact with, isn't it? So every day. So yes, I believe it is important. But these things, it's a good case, and I think you have your press union. This can be brought forward. We get the numbers. We get to know where you are, and so on and so forth. In fact, even amongst the journalists, there may be some of you who even have pre-existing conditions, and I believe those ones should be brought out very quickly, so that we can include them. But nonetheless, for the reasons that you mentioned earlier, I think we need to have the entire list of all of you, so we can look at it in the scheme of things. I think it's important. Thank you.
Yes, madam.
What side effects do we anticipate with the COVID-19 vaccination?
Side effects. Okay. Yes. So various mild side effects may occur. Of course, pain in the area. Slight swelling, erythema could occur. Some people have myalgia, muscle pains. Some people may have joint pains, headache, even feverish symptoms may be also experienced. And these are usually mild and they disappear. Anaphylaxis is possible for most other vaccines, and but it's very rare. We've not heard of a report of anaphylaxis in this case. So those are the reasons why we say the vaccine is safe.
Thank you. Yes, over to you now. Madam, no. Time is really people have been sitting this morning.
The first one is the follow-up. The second question is, let me start with the follow-up. You said the vaccination will protect you from COVID-19. So how long does the protection last when you take the vaccine?
Okay.
Okay, the other one is, I understand that there are various vaccines developed for this COVID-19, like Johnson & Johnson, you have the Pfizer, and then AstraZeneca on the COVID COVAX facility. So when is Ghana going to try other vaccine, or are we going to stick only to the AstraZeneca vaccine?
Yeah, thank you very much for that. Yeah, the first one is,
how long will the protection
yes, the protection, this is a new vaccine, as you know. Normally, when we get vaccines, we already know a lot about the vaccine because there is a long trial and observation period. Unfortunately, for these vaccines for COVID-19, they were produced in a very short time. So the observation we have is the period of observation during the testing for checking their efficacy and safety. So I think most of them are a 3-4 months observation period. So that's what we have. So during that period, it was still, working. The efficacy of the vaccines were good. And also what we know from the clinical observations, people who were infected with COVID-19 were following the illness. When they recover, they are protected up to 6 months. And then considering that, if we get the vaccine, and if it's equally effective, it will definitely minimum protect at least 6 months or even further, because we give also booster doses. It's two doses. So with these 2 doses, we are expecting a much more longer period of protection. But for now, we still, what the clear answer is, we have to wait and see. We don't know exactly for how long this immunity will last. So regarding the second question, what other vaccines can we anticipate? Yes, in the COVID basket, we have 2 already approved. One is Pfizer, and the other one is AstraZeneca. The others are in the pipeline. They are in the pipeline, not yet listed as for emergency use. But this COVID, the COVAX arrangement is actually anticipating more vaccines to come on board, because there are many at the clinical stage 3 trial. So very soon, maybe before June, we may get more candidates that will be coming to the basket of the COVAX arrangement. So if it's already cleared by WHO and it comes into the basket, Gambia definitely, because there is shortage, anything that comes to the basket will be also having access. Not only Gambia, all those that are participating in the COVAX arrangement will have access to those vaccines. But for now, it's Pfizer and this which are in the basket. And Pfizer, as you know from the information, Pfizer is very difficult because of the cold chain system. It's not suitable for most developing countries, particularly for Africa. So in Africa, there are about less than 20 that actually volunteered to receive the Pfizer vaccine. So those ones will receive. There are some countries. But for countries like Gambia, it will be very difficult because we don't have a system that can take care of it. This is what I can tell you. Thank you. Thank you.
Now close this session by, first of all, thanking the Minister and the show for the representative, UNICEF for the representative. We want to also thank the staff represented here from the show and UNICEF. We also want to thank our EPI program manager and his entire team who have been working tirelessly in this process. And we want to thank our also senior colleague members from the Ministry of Health. And finally, we want to thank the able men and women of the press who have been here. We hope that we will take the message and we will disseminate as far as possible so that we can get the message for the continent. And until we meet here, we want to say goodbye and thank you very much.
Thank you very much.
Very good. Yes, thank you so much.
Thank you so much, Honorable Minister. Thank you.
Gambia ndele bada badi bunkali alo nyaming nyakili ngo nyama dunumata la fulanda na kuka to makere la kasata ay wali mbemintole Gambian Talents TV mbo to wala kale Gambian Talents TV nyulle nata Gambian Talents TV wo nyulle nata kantole kidimandi nyulle nata kantole nganyandi nyulle nata kali se wondi nyulle nata Kali kunindi nyulle nata kali londi oto wala tinna ngoybe Facebook le wala tinna ngoybe YouTube wala tinna o ngoybe fanna bela ndabadi bunka Gambian Talents Winning TV boy ngoe wate wati nkawole la moy wate wati nkawole jube ndajawaro ngoe badi bunka Gambian Talents TV solemu mbeji mbetema ko sungalango ngoe ko mbeji mbetema ko min sungalango tay.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Gamsobis in focus with Khalilu Banjang every Saturday from 8 to 10 p.m.
You want to know about the Gambia entertainment industry? You want to know the existing policies and programs of the arts and culture sector? You want to know about the governance and management of the arts associations? The program will throw a fresh light on the entertainment industry in focus. We will touch so many angles about the cultural sector, the opportunities and challenges, and interrogate them, and most importantly, offer solutions.